the gift that keeps on giving. Lake Victoria, in her benevolence, not only nourishes her people with food, but also serves them with water for daily domestic use. But in the breadth of her fresh waters and those dammed up across Homa Bay County, lurks a parasite responsible for tearing lives apart.
Alijua nilikuwa na ugonjwa, lakini hakuwa naamini kama hiyo ndio ilikuwa inanizuia.
Nilienda hospitali, nimepata ni mwanaume, ndio nataka kuangalia, alafu nimekataa.
Sijui venye nimeipata juu I use tapped water and the one we store in tanks.
The complications that can come about when you have FGS, you increase susceptibility to getting HIV and AIDS, that's 3 to 4 times. These women are doomed from the start if we don't do something.
The waters of Lake Victoria swell up as the evening tides and the sunset time waves pull together and send the waters crashing on the beach. While these residents of Homa Bay County enjoy unlimited access of these coveted waters of Lake Victoria, every time they get into contact with the liquid that dances on the seabed, they are unknowingly exposed to a potentially life-changing illness, schistosomiasis, a neglected tropical disease that has been silently wreaking havoc in the lives of the residents. But we are here to uncover another subtype of this disease, schistosomiasis hematobium, the one that lurks in the rivers and water ponds where a simple task of fetching water or a swim in these contaminated waters is pretty much a guarantee that one will be infected at some point in their lives.
I think we should proceed.
We have come to Ruga village, Rodikopany, where Faith Awino, a female genital schistosomiasis or FGS patient, lives. Faith recently gave birth to her third child after being treated for the disease she struggled with for 2.5 years.
Hiyo shida nilikuwa nauma ni mlemo wa tumbo. Hata kaa umekaa na watu nacheka, lakini ujui watu nacheka nini au watu nacheka nini. Juu kaa ile uchafu nimetoka na rufu.
For Faith, seeking treatment for a disease that gave her so much shame was not easy. At home, her relationship with her husband took a hit, leading to them separating for a while before she had the courage to get tested for FGS.
Nilienda hospitali, nimepata ni mwanaume, ndio nataka kuangalia, alafu nimekataa. Nimerudi hapa kwa nyumba. Nimerudi hapa kwa nyumba, bado nilikuwa na hiyo uchungu. Na alafu nimetoka kwa hii nyumba. Juu huyu bwana yeye nataka haki yake na mimi sitaki. Nikaa huko mwezi 5 hivi, alafu narudi hapa kwa nyumbani. Hata bado narudi, nilikuwa tu na hiyo uchungu. Nakaa tu na hiyo uchungu tena mwezi 6, alafu naenda hosi tena. Naenda hosi, na sasa hiyo naenda miniam napata hosti. Hiyo siku nilikuwa naamua nataka nipime hata kani wanaume.
In Faith's village, the lack of tapped water means they have to depend on water pans for daily household needs. But she is oblivious of the fact that she may have been in contact with the FGS-causing parasites while on a trip to fetch water.
Hapa tulikuwa na shida ya maji. Kama hapa tulikuwa na maji ya mvua na maji ya
Trying to get Faith to share with us her experience with FGS was not easy, even by the virtue that I was a woman speaking to a fellow woman. And I can imagine the difficulty women in this community who might be having FGS symptoms have whenever they go to a healthcare facility to speak about what is disturbing their reproductive organs, and the awkwardness if the healthcare worker is a man.
This is where Faith came to seek medical help when her FGS symptoms became too much to bear. As a level 3 health facility, this health center has been identified as a testing and treatment point for female genital schistosomiasis. This struggle was not unique to Faith. Timina Ogot is also an FGS patient come HIV counselor who was initially misdiagnosed with cervical cancer.
Initially, in the year 2016, I had problems. I had bleedings, itchiness in the genital organ. Yeah. So I decided to visit a health center where I was screened for cervical cancer. Then they told me I was a suspect. They referred me to go to Makongeni Health Center. I was done cryotherapy. Going back home, I was told to go for review after 6 months. I went there and I was done ultrasound. They told me they were not seeing anything else.
When the cervical cancer diagnosis was ruled out and her symptoms were persistent, Timina was resigned to being diagnosed with sexually transmitted infections, which she says came at a huge cost to her marriage.
This thing made me add stigma here because I was feeling like I was having an unusual smell, even when we are with my colleagues. Even at home, I was getting it very, very unusual to even have sex with my husband. And we always had violence, in that whenever he wants his rice, I could name him. So this made me to be to feel very, very bad. Even the husband decided to go to another woman elsewhere. They were diagnosing UTI, STIs. So I continued to be in the hospital.
It took 9 years for Timina to finally be relieved of her symptoms. And despite working at a health center, she lacked the confidence to get tested and treated the first time she got to learn about FGS.
Now second CME came, is when I opened up and decided to be screened. And I was done everything, and I was being treated. I was given praziquantel tablets. I was given 5 tablets. Because they weighed my kg, I was 79 by then.
However, the relief that the correct diagnosis brought with it was short-lived, but her proactivity in getting assistance this time round helped turn the tide.
It didn't stop for the first time. Then I came for the second review. I met Sister Effie and told her about how I was doing. She also gave me another dose after 8 weeks. Then I took it home again and did the same as I did it for the first time. But nowadays, I thank God, I am well, and I can assure you everything is well, and the husband is back at home.
Timina says the danger of getting infected and reinfected with FGS is a daily struggle attached to the simple chore of fetching water. And she believes many women in her village could be suffering in silence due to either ignorance or the shame and stigma associated with the disease.
The waters we use, they are very fresh, and the snails are there. Even if you are just looking like this, you'll just see the snails. I know quite a number are having FGS, and they don't know. But awareness should be done so that they should come here and get treated.
Juliet Adhiambo walks into the Homa Bay Teaching and Referral Hospital for a review since she was diagnosed with FGS, which she first mistook for a urinary tract infection or UTI.
Nimekuwa na shida ya itching and I've been buying drugs over the counter for about a year. Towards September, nimekuwa na shida kwa abdominal pain. Kama niko kwa intercourse na partner wangu, nasikia some pain.
Unlike Timina and Faith, who live in the rural parts of Homa Bay where they depend on water pans and rivers for water, Juliet says she has never stepped into a water pan or even the lake to fetch water, and so how she contracted the disease is still a mystery to her.
Sijui venye nimeipata, situmii maji ya lake. I use tapped water and the one we store in tanks. Sasa nilikuja kwa daktari, nikaelekezwa cancer center nifanyiwe screening. Cervix ilikuwa na, waliambia ni kama niko na dalili za bilazi. Nilipewa madawa, nikatumia, sasa sioni shida yoyote.
Schistosoma mastomas antigen. But we test for them in urine.
Until December 2023, no health worker here in Homa Bay County could diagnose female genital schistosomiasis. And those with FGS symptoms were often handed a wrong diagnosis, and one that spelled doom for women in relationships.
I really just had a clear idea once I came to the field. I was able to interact more with the women and just understand their path to care. Because this is something we don't talk about. That you're seeing someone, she was here in the hospital yesterday, she was here a month later, and the whole time I kept judging and probably insisting that she probably has a sexually transmitted infection. And most of the time I would probably call the partner and still accuse this woman for, having stepped out of their marriage. So when you see that pattern of consistent misdiagnosis, part of the things that we're trying to do now is really breaking that cycle of neglect. It's just trying to show there could be something else to increase your index of suspicion.
Dr. Victoria Gamba is an obstetrician gynecologist who is coordinating the ongoing study on the integration of female genital schistosomiasis in the sexual reproductive health policy undertaken by the Ministry of Health, LVCT Health, and the Departments of Health in the counties of Homa Bay, Kilifi, and Kwale counties where the disease occurs. Now past its 2-year mark, the researchers are now disseminating the findings to the health workers.
I think the main motivator for me was the fact that I didn't know about it early enough. It's a hidden disease and not many people want to talk about issues with the genital tract. And I think that was the main reason why I joined gynecology really as a practice, to really help women to understand that it's not normal to have such pain. It's not normal to have persistent discharge. It's not normal to have this issue. And there's something we can do about it.
What struck Dr. Gamba and her team was that there was neither a definitive way to screen for FGS nor the diagnostic tools to do so.
Because FGS is never taught even in the medical schools. I'm a nurse by profession, but it was never taught. One can easily misdiagnose or misconstrue the signs of female genital schistosomiasis, especially the lesions, to cervical cancer, which is not the case, and the opposite also.
The percentage of women in endemic areas who are likely to have female genital schistosomiasis is around 1/3 to 2/3. That's what has been estimated. From the study, there are particular areas we would find, even as we go for outreaches, even up to 50%, because I've seen the complications that can come about when you have FGS, from your increased susceptibility to getting HIV and AIDS, that's 3 to 4 times. Then, of course, if you have HIV and AIDS, you can get cervical cancer, which the risk is increased up to 6 times. So I mean, these women are doomed from the start if we don't do something.
For the longest time, any woman who had FGS symptoms, whenever they came to the Homa Bay Teaching Referral Hospital, they would be referred to the cervical cancer screening clinic. Even then, the health workers had no idea on how to test for FGS, but it is in capacity building sessions such as these ones going on right here at the Homa Bay County Referral Hospital that is equipping healthcare workers to identify this disease even at the lowest level of healthcare facilities.
But in the 2.5 years of this study, more than 1,000 health workers in Homa Bay, Kwale and Kilifi counties are now able to screen and prescribe treatment for FGS among patients.
We've trained a total of 471 CHPs across the 3 counties, and we are expecting that with the same training, they are also informing the community. For the healthcare workers, for the TOTS, I've mentioned we've trained a total of 75 in the 3 counties. Currently, the numbers who've been reached now by the healthcare workers themselves, the TOTS, are 700 healthcare workers have now been sensitized.
In our language, we call it rariu. So they think it is something obstructing you from doing something. And yet, it has been an FGS which has reoccurred has not been treated. So nowadays, when a mother comes, we do the screening, we get real FGS. These are real FGS and we treat them. So many of them have been treated. We've created so many awareness. So the numbers, the population who are having the FGS positive now, they are now decreasing.
According to the World Health Organization's Pocket Atlas for Clinical Healthcare Professionals, female genital schistosomiasis is a manifestation mainly of the schistosoma hematobium parasite that gets into the body when a person gets into contact with an infected freshwater source that has snails, which are the temporary hosts of the parasite. Once in the bloodstream, the parasite then nests in the urinary and reproductive organs of the hosts, where it lays eggs, and it's the eggs that then trigger the symptoms, namely vaginal discharge, bloody discharge, bleeding after intercourse or spotting, genital itching or burning sensation, pelvic pain or pain during or after intercourse, and blood in urine. Complications that arise from an untreated FGS infections include bleeding during examination, infertility, abortion or ectopic pregnancy, involuntary urination when coughing, laughing or jumping, genital ulcers, tumors or swelling in the vulva, vagina and cervix. Other complications of schistosomiasis include anemia, stunted growth and abdominal cramps.
It can lead to secondary or primary infertility. So if a woman gets to that stage, then that means this woman can even be ostracized from her home because she's not able to give birth, yeah? Or she may feel like she's useless in that family. So it can lead to such kind of stigmas or isolations.
Currently, an estimated 56 million girls and women of reproductive age are said to be suffering from this disease in sub-Saharan Africa, and it is the lack of definitive data that has Dr. Gamba and her team here in Kenya under pressure to provide solutions to this disease.
Currently, healthcare workers are just trying to be innovative to use the cervical cancer register and under the remarks section. But if we had a way of documenting it clearly, then it could really bring about or showcase the results of the work these people are doing. Already it is great, but it is inside a register which is meant for something else.
So in terms of now getting to diagnose this, we have found a way to just marry the environmental risk. Then there are specific signs that we look for when you're doing the examination. The most interesting bit is Homa Bay County actually came up with a mnemonic, which were clearly defined by the WHO. We call it the Rusha Macho technique. Really, it's about using your eyes. And there are 3 things that we look for. That is the rubbery papules, the homogeneous yellow patches, and the sandy grainy patches. What would now change it to become an ideal diagnosis is when you have the laboratory support. And that would require PCR examination, which is mostly not available in most of the facilities that we have been.
FGS has also been linked to the prevalence of gender-based violence in the affected communities.
Women are beaten by their husbands for denying them sex, or eventually would lead to separation. A woman, because of that pain, may refuse. to do sex. And for us, men who do not understand, that will be a taboo, denying your husband the right to sex.
We get women and girls who come because they've been assaulted, because the husband probably thinks they had extramarital relations. And also the fact that they can have recurrent miscarriages or also infertility, because these are some of now the broader complications that you can have when you have female genital schistosomiasis. So you come from a point of weakness.
The WHO prescribed treatment for FGS is praziquantel, a tablet that serves two purposes: to relieve the patient of the symptoms of FGS and also as a preventive measure. Previous studies across Africa have also established that early administration of praziquantel before the ages of 20 to 21 is highly effective in preventing the development of FGS lesions once infection occurs, with studies showing significantly lower rates of sandy patches, contact bleeding and subfertility in women treated at a young age.
Treatment with praziquantel can prevent the formation of lesions, because if you're stopping a woman from having an infection, and then that sort of cycle of lesion development can stop in the middle. Once a woman already has lesions that are part of FGS, then it can be difficult to reverse those. We know that treatment with praziquantel, based on research studies that are published and available, can alleviate the symptoms that a woman might feel of female genital schisto. But we are not, there's no definitive evidence that those lesions can be reversed or cured.
And it was mostly given as donations. So most of the time, it was not being procured. But through this study, which we are trying to do the morbidity assessment to now show the need why counties should now procure this drug, we've been able to see the positivity rate for female genital schistosomiasis cumulatively for the 3 counties at 27.69%, which is pretty high. That means more than a quarter of the women and girls who are coming were positive for female genital schistosomiasis, and they've never been tested for that before. We're trying to co-design together what is an ideal test, so that you see, you give that woman a holistic kind of treatment or diagnosis first, then they get the actual treatment they need.
Globally, the disease is also gaining attention. An epidemiological study in 6 African countries by the Coalition for Operational Research on Neglected Tropical Diseases is underway to better estimate the number of women affected by FGS, helping to define the true scale of the problem and support the development of new treatments and health policies.
Why is this study significant, or why is it important? Because ideally, the generalized data is that about 56 million women and girls suffer from FGS. And when it comes to the challenge with NTDs, is that usually they are underreported or unreported. So even getting funding from the Ministry of Health is usually a problem.
Currently, we are managing a 6-country research study that is looking at the burden of female genital schistosomiasis across sub-Saharan Africa, collecting data from almost 10,000 women and girls across those countries. And then that data will be taken and used in mathematical models to try to get a better estimate of how many women across sub-Saharan Africa are truly at risk of developing female genital schistosomiasis. We're also collecting data on sexually transmitted illnesses and the human papillomavirus, so HPV.
NTDs are a group of neglected diseases that we talk about. They affect many people, and most of the time they're people who live in poverty situations, and most of the time their needs are not really brought to the mainstream. And I think through this we're trying to show that they should be incorporated into the health systems as well, and not just research or even donor dependence. It also affects men. And men, every time we've gone for community outreaches, They've often reached out that you've tested my wife for this, she was positive for this, and you did not ask me about it. So what are we doing? Even the men, we're calling them out to also come for services because we are now more aware. Because really when you follow the pathophysiology of the parasite, when you follow it, how it interacts, the host and the agent, you can actually see exactly all these tracts can be affected.
And in the wake of funding cuts that have already had an impact in the quality of services being offered in other sectors of healthcare for neglected tropical diseases such as FGS, finding local yet tested solutions to stigmatized health complications is a goal Dr. Gamba and her team are striving towards achieving. Bridget's Ghana, NTV.